Good afternoon, class. Our lesson for today is all about sports injury management. Sports injuries are often soft tissue injuries to muscles, tendons, ligaments, or joints. The first step for treating any kind of injury is to contact a qualified physician who can provide an accurate diagnosis. The doctor is the only person allowed to diagnose the condition of the patient. Sports injury management is the management of a specific injury to allow an individual to return or continue their chosen sport without damaging or compromising their body. Managing a sports injury correctly is important and can help to minimize damage to a muscle, tendon, ligament, and joint, hence increasing the chance of a full recovery. The diagnostic process accounts all the information needed to see a holistic picture of the cause and severity of the injury, such as patient's history, comprehensive physical examination, it is an exam performed by a doctor looking for any signs of disease or treatable medical conditions. While medical history is typically done first, looking at any medical history, which will be examined further throughout the examination. Special and diagnostic test. It is generally used to discover the underlying issue that brought a patient to the doctor in the first place. Examples of it are X-rays, computer tomography, and magnetic resonance imaging. The first part of the evaluation process is called the primary survey. This is a quick evaluation if there are life-threatening injuries present. The evaluation needs to consider if the patient should be moved or transported immediately to a medical facility. Next, how could a life-threatening condition be determined? The cardiopulmonary resuscitation or CPR should be performed immediately on any person who has become unconscious and is found to be pulseless. In performing the following basic CPR steps for unconscious adult, there are two main stages of CPR, the preparation stage and the CPR stage. In preparation steps, step 1, call 911. First, check the scene for factors that could put you in danger, such as traffic, fire, or falling masonry. Next, check the person. Do they need help? Tap their shoulder and shout, "Are you okay?" If they are not responding, call 911 or ask a bystander to call 911 before performing CPR. If possible, ask a bystander to go and search for an AED machine. People can find these in offices and many other public buildings. Step 2. Place the person on their back and open their airway. Place the person carefully on their back and kneel beside their chest. Tilt their head back slightly by lifting their chin. Open their mouth and check for any obstruction, such as food or vomit. Remove any obstruction if it is loose. If it is not loose, trying to grasp, it may push it farther into the airway. Step 3. Check for breathing. Place your ear next the person's mouth and listen for no more than 10 seconds. If you do not hear breathing, or you only hear occasional gasps, begin CPR. If someone is unconscious but still breathing, do not perform CPR. Instead, if they do not seem to have a spinal injury, place them in the recovery position. Keep monitoring their breathing and perform CPR if they stop breathing. In CPR stage, step 4, perform 30 chest compressions. Place one of your hands on top of the other and clasp them together. With the heel of the hands and straight elbows, push hard and fast in the center of the chest, slightly below the nipples. Push at least 2 inches deep. Compress your chest at a rate of least 100 times per minute. Let the chest rise fully between compressions. Step 5. Perform 2 rescue breaths. Making sure their mouth is clear. Tilt their head back slightly and lift their chin. Pinch their nose shut. Place your mouth fully over theirs and blow to make their chest rise. If their chest does not rise with the first breath, retilt their head. If their chest still does not rise with a second breath, the person might be choking. Step 6. Repeat. Repeat the cycle of 30 chest compressions and 2 rescue breaths until the person starts breathing or help arrives. If an AED arrives, carry on performing CPR until the machine is set up and ready to use. Next is the first aid management for acute injuries. First, inspect or observation process. The coach or trainer should inspect for deformity, swelling, dislocation, bleeding, and other possible signs of injury. The following questions can help when performing inspection. First, how is the athlete positioned? Is there an obvious deformity, bleeding, skin dislocation, and etc.? Are there an unusual bumps and bruises? Is the bone and joint aligned normally? And lastly, does the athlete complain of more pain when more pressure is applied? Second, identifying the location of the injury. The location of the injury helps the coach and trainer understand the possible structures that could be damaged. The following questions can help in identifying the location and mechanism of injury. First, what body part of the athlete needs support? What body part can he or she not move? Did the athlete feel or hear before the athlete complained of pain? Was there a contact before the athlete complained of pain? What was the athlete doing before he or she complained of pain? Next, identifying the type of pain: dull, sharp, and radiating. The severity of the injury is usually related to the amount of pain experienced. The injured athlete can rank pain, 1 being the lowest and 10 the highest, to reflect the amount of pain. Lastly, the coach or trainer understands how the movement or force could have injured the body part. It will help in determining the appropriate first aid and how to immobilize the injured part. Motor gross movement is the active component of the secondary survey, and it checks muscle weakness and joint stability. The following questions can help when performing a gross motor check. First, can the athlete move the injured limb on his or her own? Can the athlete move his or her throughout its entire range of motion? Can athlete sustain the movement when resistance is applied? Does the athlete limp when he or she walks? Does the athlete have a problem balancing his or her weight? And today, we have our splint. It is a rigid support made from metal plaster of plastic. It's used to protect, support, or immobilize uninjured or inflamed part of the body. Splints have various purposes, including immobilization, support to promote healing, positioning or supporting during function, pain relief, substitute for weak muscles, prevention and correction of contracture and deformity, restoration or maintenance of range of motion, and edema control. That's all for this supplementary video. I hope you can get helpful knowledge from this presentation. Thank you, and may God bless you.